All right, let's unpack these numbers now with Professor Adrian Puren from the National Institute of Communicable Diseases. Prof, thanks for your time. We appreciate it. Just looking at these numbers over the past couple of days, I see it's below 20,000. What are you witnessing in the trends?
Yes, again, I think we just need to be cautious about the numbers, especially over weekends. I think Wednesday is probably the better day to look at, and looking at the 7-day average. But nevertheless, I think overall the view is, at least for Gauteng, it would appear that it has reached its peak, and now we can see a downward trajectory in the numbers there. Whereas I think in all the other provinces, we have a very sharp upward trajectory, and as you noted, the KwaZulu-Natal has the largest proportion of the new cases. However, one or two of the provinces, I think it was Northwest, or one of those particular provinces as well, seems to have reached its particular peak as well. So yes, still an upward trajectory, high positivity. But again, remember, given this high positivity rate, we don't really know what the actual numbers are, because it's in about 30-odd%, or if not higher for some of the provinces in terms of positivity. So the numbers are probably much larger than we actually are reporting.
Yeah. All right, let's talk about hospitalizations, because this is something that is being monitored quite closely. What have you found there?
This is up to date. I think the view is still that the degree of hospitalizations is still remarkably different to what we've seen with the third resurgence. I think there's still an element of caution, especially as the numbers go up again. We're still hoping that the proportions reaching our hospitals will remain as low as they are, in order for us not to reach a situation where the hospitals are being overwhelmed. So I think that's a good sign, at least, but I think we just need to be cautious about those particular numbers.
Yeah, I see that 8,435 patients are in hospital, and 6.7% of them are in intensive care units, according to information from the NICD. Prof, let's talk about the deaths over the past 24-hour period. It's at 105, and this compared to the previous days that we saw, 30, 40, 50, etc. This seems a bit high. Why?
Yeah, so again, I think we just need to be cautious what that number means in terms of whether or not there are lags, because I think there are some data lags which may explain it. So I think let's just keep an eye on that and see whether those trends continue up, which they most likely will, but hopefully not to the extent that we've seen in previous resurgences, and that it's in keeping with for example, the hospitalizations. As you know, the deaths and hospitalizations are lag indicators, so let's just keep an eye on that. But let's hope that they remain at that sort of level. It's unfortunate, of course, but let's hope that it does not reach the levels that we have seen previously.
Is it still too early to tell when we're going to reach a peak nationally, given that we've seen it already in Gauteng?
Yeah, I think some of this is really difficult because, again, there's heterogeneity across the provinces, and what contributes to the peak obviously relates to levels of vaccination, levels of previous exposure, levels of contact. We're going into this particular period now when there's greater mobility of people, greater contact, which means the risks have increased. And as you've noted, Omicron has a remarkable rate of transmission, and so we may well still see the numbers go up. Therefore, a peak for the whole of South Africa may be difficult to predict. So there are variations, not the same extent as I think we saw in the Delta resurgence, where there was marked heterogeneity. The extent of the heterogeneity across provinces is not as different compared to what we saw with Delta. But still, I think it may well be difficult to say in the next 2 weeks or so we may see declines. But we're already seeing in one or two of the provinces that there are already declines, other than Gauteng.
Are you expecting there to be an increase, though, given that people are now on holiday, letting their guard down, and obviously Omicron being so transmissible, that could be problematic?
Yeah, so again, I think we need to re-emphasize to all our communities. I know it's very difficult during this period. We've gone through 2 years of this particular pandemic, but again, I think we need to reiterate that we should really try and limit our risks as best possible. We are at level 1, which I think is a good thing. But I think then within that level 1 framework, I think we really do need to make sure that we as citizens behave responsibly as best that we can. In other words, still wear those masks, still physically distance, be in ventilated areas or outdoors, and get vaccinated. I think that's the key component here. We do not have data currently. I mean, there is some data showing that it's likely that unvaccinated people are reaching our hospitals. But again, we really need the data for that, and I'm sure it will come through. But I think I would still like to encourage people to be vaccinated. We know that the vaccines are not foolproof in the sense that there may still be infections and transmission, but these should be milder infections. But the main reason for this is obviously to prevent hospitalizations, and therefore that's the best reason for being vaccinated.
All right. Thank you so much for your time and the insight. Appreciate it. Professor Adrian Puren from the NICD.